Now, when Justin came in later, third, fourth visit, we started working a little bit more on balance. So we did this on an AirX pad, but ours is being used right now. So if you don't have an AirX pad, you can use a couch cushion, you can use towels, you can use anything that challenges their balance. So Justin, go ahead and show them what we were working on. So what I like to do is single leg balance. And this is a pretty heavy medicine ball. It's about 10 pounds, which is much heavier. Go ahead and spell the alphabet with that, Justin. It's much heavier than I normally do, but Justin's progressing well, so we're challenging him. So spelling the alphabet is nice because it challenges your balance in many different planes. But one thing I noticed when Justin did this, even when he wasn't doing it with a ball, but just trying to use balance, is his balance wasn't very good. And I didn't think it was due to the ankle injury at all. And what we noticed, he's not doing it anymore, but what we noticed is Justin's great toe just stayed right up in the air, just like that. Thanks, Justin. When he was balancing. So we pulled him off there. Go ahead and come off there, Justin. And go ahead and walk for me. And yeah, let's just go back and forth here. So if you look at Justin's left toe, he still does a little bit, but not as bad. Are you exaggerating just to show us now? No. Okay. So you can see his toe when he walks just comes up. And he's actually not nearly as bad as what he was before. But he didn't use his great toe. So we worked on exercises where he's walking, pushing through that great toe, and especially on balancing using that great toe. And if you remember that on the first video, he had tenderness around those flexor tendons. If he's extending his toe every time he walks and he dorsiflexes his ankle, he's putting a ton of tension right there. So no wonder why he was tender with a little swelling. You go ahead and stop, Justin. All right. So next, we had a lot of, the main issue was dorsiflexion limitation. So what we did, is this mobilization with movement technique. So you want to keep the foot 4 finger widths back, like the back, and really his finger widths, but we got him pretty close. Now put your hand on the tibia and fibula there. So as his knee goes forward, he slightly internally rotates the tibia for tibial internal rotation with dorsiflexion. And you try to touch the wall without the heel coming up. Now you want to make sure their knee is going over the second toe and not the first, because most people will kind of try to bring that towards the midline, and you don't really want that. All right, let's go ahead and go in here. So we had him work on that for really about a week, and it almost completely improved and actually got better than the other side. It's tightened up a little bit because I haven't seen him in a little while, but it actually got better than the other side in about a week. So the next thing I did, go ahead and lay yourself, Justin. Was a tibialis posterior stretch. So what you want to do is put the ankle in eversion, dorsiflexion of the ankle, and then I put my fingers on the navicular and the cuneiform bones, and you press down. I use my chest with a little bit of extra pressure. You okay? Yep. Okay. It can be a little bit tender on their feet, but most people aren't too bad. The interesting thing about this stretch is most people don't feel the stretch sensation, but they will feel the tension. So kind of getting some feedback from them is really important with this. So we loosened up this posterior tib, and then we did a heel whip. So kind of getting on that calcaneus there, just using the momentum and kind of ulnarly deviating your wrist and just kind of feeling it, and just like that. And you'll just feel a little click in there. It won't be a super loud pop or anything. So loosen up the calcaneus for mobility. And then now to the interesting part. Okay, Justin, go ahead and flip on your back. So we expected Justin to be done in about 4 or 5 visits and about 2 weeks to be about 95%. So Justin comes in on his 5th visit and he's only feeling about 85%, still having some issues. So we did everything we normally do. It was a little better, but not much. And I know we took the right approach. So started looking at, okay, what else are we missing? And started looking up and down the chain, looked in the foot, nothing there. Started going up here, checking the tissues proximal to the injury. Checking on here, I'm kind of talking to Justin when I'm doing this, you know, and just feeling the tissues but not necessarily looking. And all of a sudden, I hit a spot right in here. I'm like, whoa, that doesn't move. That doesn't move at all. So, so we know we need to work on this And if you get really close into here, come into here so you can see this. There's a little bitty scar right there that's really covered up really well. There's a bigger one here that you can kind of see, but this one wasn't the main problem. This one right here really was. Okay. And that scar is really covered up with the tattoo. You really can't see it well at all. But, so talking to Justin, like, what started these scars?
Skateboarding accident in my teenage years with the car. I kind of ended up my leg under the car where one of the bumpers kind of peeled back the top layer of tissues and almost to the bone. So
yeah, so a pretty bad scar that was actually limiting his mobility in dorsiflexion because it was really limited medially and superiorly here. So when he tried to dorsiflex, this skin on the medial shin really wasn't moving. So we we already had a little bit on here. I'm just putting a little lotion on there as well. So we kind of scanned the tissues just like this, and it was bumpy, like really bumpy. So we just scanned it along the shin. Okay, went kind of at not a real sharp angle because this can be a really tender area, and scanned various different directions to see where the limitation was. It's kind of, like I said, it's kind of superior medial. Got the Batman tool here. Went after it. Just a little bit, and it didn't take long. It was probably a minute and a half, 2 minutes. And had him get up after that and squat pain-free, lunge pain-free, and push-offs were pain-free. And his motion was 100%. So, a minute or two treatment was very, very effective. So, and then I followed up probably the next week, and I think you reported you're back to soccer, no problems with CrossFit. So really effective treatment. So I think kind of when you're working on these things, remember to look distal and proximal. In this case, I think we approach it the right way, but without getting really close in here, I just didn't see these scars. So patient has a tattoo, proximal or distal to the injury. Remember to kind of check those areas out and see if there's anything you can work on there. Had a great outcome for Justin, and